The biggest thing I see there, I mentioned before, is the hip flexors almost always are involved. Because even if they weren't part of the initial problem, they're kind of a guarding reactive muscle. And it's amazing how much pain can be resolved just by getting those to calm down with the right treatment. Getting, not just with stretches, but you actually kind of go through the stomach and work on those. But I'd say probably back strain due to core weakness and overload of the hip flexors would be the most. Definitely plenty of joint stuff too, especially as people get older. Well, I use manual therapy stuff to release those. And then I teach them how to stretch them. And then usually there'll be some joint mobilization involved too, because usually if there's a problem with the hip flexors, quite often there's an issue at some level of the joint. You can kind of test each individual level and mobilize that joint and make sure they're just good and strong in the abs, you know, long term, so that the hip flexors aren't doing too much work. With true cyclists, it's not just, you know, they're clipped in and they're pulling up as much as they're pushing down. So I see a lot of, not just the psoas hip flexor stuff with them, but a lot of TFL, tensor fascia lata, and that usually is involved with really tight IT bands. Rarely I'll have a cyclist, and I see a number of them come in without a pretty tight IT band, TFL. I mean, you touch it and they're like, oh, you know, they feel great when you're done, but it's kind of torture to get through it. You know, definitely teaching them to get on a lacrosse ball or a foam roller and really get into these areas here. I know some people say lay on a ball to get the psoas. I'm not a big fan of having people do that. There's just a lot of stuff going on in there, and I feel like you should have kind of the skilled hands of weaving through the viscera to get down to that, and not just laying on a ball, you know, in the abdomen. But here, yeah, go for it. It's a lot of complex things there. If they have any kind of impingement at the hip, it's going to cause them on that side to kind of rotate and lift up, especially in arrow position. If they're riding up top, it's usually not an issue. But I'll have them bring in their trainer, you know, and bike, and I'll watch them, and, you know, first of all say, how symmetrical are we looking here? Are they lifting one hip versus the other? That's usually going to identify the issue. And if they feel that pinch there, or it could be a number of different tightnesses, weaknesses. It's such an amazing sport because you just move everything, you know. I mean, you got everything from an impingement at the AC joint on the backswing to, you know, hip arthritis because they're rotating over it. And then of course the back stuff. With golfers, I probably in the clinic see more back issues than anything. And really if they, you know, were just more active or more focused on stretching rather than just being always so strong, you know, and just having the range of motion to get back, you know, to get into those ranges of motion, I think a lot of that could be, you know, that could be helped with. I could come maybe in a few months and do something specific for golf if you guys are interested in that, because it's an incredibly big topic, actually. There's all kinds of things that can go wrong in a swing and hurt the body. And I hope I'm not offending anyone with this, but leg throws. I feel like with leg throws, you know what I'm talking about, where they grab your hands and you're throwing their legs like that. I feel like in some people it is appropriate and okay, but I think it's pretty limited to probably gymnasts and divers. I was a diver at Texas. We used to do that a lot, and it was fine for us. But I mean, I think the population that can do that safely is really, really small. And there's just so many great ways to strengthen the abs. It's like, why use things that put people under so much stress? Because to have that kind of a force going down, your abs got to be so strong to keep from going into that back arch. So that would be one. And I didn't see in y'all's gym, I don't think y'all have it. Do y'all have the seated machines where you sit and you crunch down on a bar? And okay, so I'm sorry to say this, but I would probably like sell it for scrap, because when you, and again, I hope I'm not offending anyone, but I'm glad we're talking about this, because this would be a good thing to kind of spread the word by. As compared to lying and standing, when you sit, the pressure, and they've measured this in studies, through the lumbar discs is astronomically higher when you're sitting, right? And you know, if you add flexion to that, then you kind of, if you guys know much about the disc, the outer part of the disc is tough, and it's what keeps the gel inside out. But if there's any kind of tears or weakness to it, it's usually going to be on the back side because of posture and the things that we do. And that gel is kind of pushed to the back. And if you're sitting with that compression and then adding a weighted flexion into it with all that abdominal pressure, it's a recipe for disaster if someone has any kind of already a bulging disc or something like that. And quite often people have bulging discs with no pain at all. They don't even know they're there. You know, like 35, pretty fit, you do an MRI, their back looks terrible. And they're just like a ticking time bomb when you're doing that kind of stuff. There's, again, so many ways. You just put a weight on their chest and have them do it on the ground as a crunch, you know. Also with rotation, you have the compression and then you have a shear force, and that's a really good way to tear a disc as well. So I would really avoid those two machines, and if you see other people using them, you know, I would warn them about it and, you know, explain why. Again, it's kind of a dependent on the person, but yeah, I mean, you need to have strong back extensors. I wouldn't overweight them too early. I would make sure that they know how to do a really good transverse abdominis contraction. Does everyone know how to do that, or how to instruct that? With getting them to activate their T, I'm sure you do. Yeah, exactly. Belly button to spine. That's one of the more important, you know, contractions. You can, if you palpate your anterior iliac spine and just go with your fingers to the soft tissue right inside of it, you can have them do this too. And you bring your belly button towards your spine. If you're doing it right, you'll feel your transverse abdominis, it's your deepest abdominal muscle, great stabilizer of the spine. It'll firm up and push out into your fingers. And that's, before I had them doing back extensions, I'd make sure that they have a really solid contraction of that they can do it without holding their breath, and hold it for like 20 seconds at a time. So I make sure those baseline things are there before I have them doing that. But I mean, it's a good exercise just when they're ready for it, yeah. Well, if they're having thoracic mobility issues, I like to start them, if they're not in the clinic getting manual stuff, but get them on the foam roller, you know, and just kind of get it worked out and loosen it up like that. And then just combining it with different, you know, arm drives with lunges, you know, going off to the side, reaching under, that kind of thing. If you have like a cage or, you know, things like this you can grab onto, and just kind of driving in different directions, you know, as you're working them. That usually does a good amount of loosening for them. Thank you. Thank you guys. I really appreciate it.